Hey everybody, welcome to Ask the Anabolic Doc, starring Dr. Thomas O'Connor, brought to you by his book, America on Steroids, A Time to Heal, and his websites, anabolicdoc.com and metabolicdoc.com. We have a departure from the regular types of topics and questions today, something we've never really got into, and it was Dr. Tom's idea based on recent circumstances, and it's the mental health of bodybuilders and strength athletes in general, something we never really talk about. And Doctor, what was it that sparked this discussion today, or the need for this discussion today?
Thank you so much, Ron. Just another week. Thank you so much, everyone, for having me on the show, and for everyone who's supporting both our videos here and on my website. So unfortunately, last week I lost a patient, committed suicide. So I've been through a couple of these, I don't know, a dozen or so, and this has nothing to do with steroids. This has everything to do with just overall mental health. And it's in America, it's outside America, there's no political, this has just happened. So I want to talk about it today, but I want to talk about it, how it relates to the fitness staff, the fitness people, and I definitely want to talk about it on steroids, because I'm the only person that will do it.
Yeah. So, this is basically depression is what we're talking about, right? And this is, I think there's a lot more awareness about it now, and it's not such a taboo subject where, before we thought it was a really rare thing where maybe occasionally these people got depressed and hid away. But now we realize you could know somebody, see them every day, and they smile and they do their job and they talk to you like everything's fine, and then, come to find out, maybe they commit suicide, and you found out secretly they were depressed and they were feeling horrible, terrible feelings, and they were just internalizing it and not sharing it with anybody.
Yeah.
And I mean, these, I don't know how much you know of the case histories of your patients, the dozen patients that have been through this, but, were these people that appeared, quote unquote, normal on the exterior that everyone thought was just fine?
So here's what I want to go into. So in my business, I'm a primary care doctor, internal medicine doctor. So, and I do a different type of practice setup where I'm a retainer-based concierge or boutique. So people come to me and I spend a lot of time. So I know these patients intimately. And that's why we're doing this, Ron. You just hit, again, you're a very good interviewer, Ron, because that's the question. So the truth is this. Let's talk about depression. So these patients all have what's called underlying mood disorder. So let's review mood disorders. And I didn't even have to review for this because I'm an internist, so I know the basics. I'm not a psychiatrist. Yeah. So mood disorder is, there's bipolar, there's standard depression, Ron.
Yeah.
And this is, again, this is everyone out there who has a doctor, men and women, their doctors know this. But again, they're so hurried. When we get these certification exams in med school and residency and training, these people know a little bit about all this. I'm throwing props to doctors and nurses out there that they're over 40 people a day. How the fuck are you going to be able to focus on? So I see about 10 a day because I'm a retainer-based doctor. Now I only do it for men.
Yeah. So
you can imagine it's so specialized, and it's only men that are on testosterone, looking for testosterone, or they're on steroids. So this is my niche in the world, and it's so fun, it's so meaningful. So patients come to me when I do my history, Ron. Remember we always talk about the H&P?
Yeah.
When I do my history, it comes out confidentially because I take everything in, and it will come out either on the reviewer systems or directly. I say, so sir, tell me, what are your medical issues? And those, blood pressure, the cholesterol, all my usual shit I talk about.
Yeah. Who
Who cares about that stuff today? I don't even care about it today. So they'll say, Doc, I have depression. And okay, well, tell me about it. Well, since I'm a kid, it goes way back. Is it from this? Then you start weaving in these real stories of post-traumatic stress disorder, all these issues that people have. I'm sorry about the dogs in the back.
Okay.
Those are my poodles. So you start hearing the story of the depression, Ron. They've had it since a kid, or maybe they had it as an adult, and you hear about the details of it, how long they've had it for, what medicines they're on, have they been hospitalized. Ron, This is serious, really serious stuff. David, come upstairs. I'm online.
Yeah. Tell me, doctor, though, I mean, you deal with men, those are your patients, that's your practice, and I would imagine that a lot of men suffer from depression and never report it because it's sort of a stigma. It's sort of looked at as a sign of weakness to even admit that you can be depressed. What's wrong with you? Aren't you a man? What are you sad about? What are you crying about? As from young children, we're told not boys are, well, maybe things are different now. It's a different world, but we were showed not to cry, not to show our emotions, not to talk about our emotions. That's the masculine, model. So it must be tough for these guys to open up to you like that.
So younger men are definitely, because of the nature of our societies, opened up more. Younger men, I don't know, 40s, 30, less than 40.
Yeah.
Men that are 50 and over, they're come from a culture of, you're right, shut up, you're a man, suck it up.
Yeah.
You don't complain, you work, you shut up, you work, and you shut up, and you just work and shut up.
Right.
And this is just a stoic culture of men. This is why I do what I do, Ron. I love doing what I do. So, but the younger guys are coming now. The caregivers are overwhelmed. Anyway, let's get back into depression. What's depression? Yeah. There's major mood disorders. Okay, there's basically this is just 101, right? Like depression 101. You got generalized depression, and then you have manic depression, which the men I see. So please listen to this, everyone. I even have a little of this. I'm a little bipolar. So now a lot of these men are very functional because to have bipolar means you don't even have to have depression. You have to have mania. So do you know what mania is, Ron? Do you know what a manic episode is? Yeah,
it's these long bouts where you're just super energetic, creative, productive. I mean, it sounds like a great thing on the surface.
Yes. So I take care of, now we're going to get into the steroids, right? Yeah. This is why I have this incredible perspective because of what I do for a living is seeing men on steroids that have depression because they have depression like anyone else could have it. It's not their fault. And because the chemistry in the brain, dopamine, serotonin, and norepinephrine. And again, I'm not a psychiatrist, but any good doctor knows this. And if you're a general practicing doctor or a nurse practitioner, you're seeing this all the time. So these men have an underlying mood disorder. Most of the men I see, they have a bipolar type mood disorder because what better condition to have to get to the gym and to be great so they need less. There are episodes of, you hear these famous people where they I don't know, I've forgotten the movie stars, but and you hear it with women for some reason more, but it's equally as apparent in men that they go for 2 or 3 days without sleep and they end up in the store stealing, but they're worth $10 million.
Yeah.
so it's odd. They're doing it because it's a high. So it's called, they're kindling and they're having these episodes where they're manic. And now you can imagine drugs and alcohol play a great role in this for regular people. Now, bodybuilders, fitness people, steroids are accessible to the world now. The latest data says 12 million people in America are on steroids. I don't want to get into that. I don't know where that number comes from, but 12 million. You can imagine, you and I probably know that's probably right, or it's even more.
I think I know 8 million of them, but go ahead.
So here we have depression on steroids. Let's talk about it. So these are men. I just take care of mainly men, with the steroids and the testosterone. I'm an expert in testosterone. You don't have to be on steroids to come see me, by the way. I have a whole growing division of men that are just regular guys that want to be evaluated for low testosterone. This is my steroid show because it's called Ask the Anabolic Doc.
Yeah.
So this is and I love this show, and it's very meaningful because you guys gave me my start 10 years ago, and I do appreciate it. Oh, wow. So, and I'm always going to do this. It's never going to stop. So mood disorder, these are men. They all have most of them are manic depression. This week I took another man in brand new that has straight up depression. He's on 2 or 3 medicines. They're refractory. Psychiatrists have given them every basic medicine, Zoloft, Paxil, Prozac, Wellbutrin, and then they start adding other medicines to these double, triple medicines. Ron, I don't do this, but I work with a psychiatrist. It's so incredible. Something happens in the brain of people that have depression. It's amazing. And so once you have depression, unless you went through an episode of a major mood disorder, without the mania, you can come out of it. I had a bout of I had a real true episode of depression several years ago. And I'm humble for what that did to me. And my life has changed ever since that period. More for understanding and being caring to my patients. Because I was never abusive to my patients or obnoxious, but I was just like, what is this depression stuff?
Yeah.
And when I had it myself, mine was episodic from an episode. The moons lined up and I had a bad time. And your brain, can you imagine your brain changes because of intangible events?
No, I mean, that's terrible to even imagine. And I know it is. It's depression is it entirely brain chemistry? I mean, a lot of
It's
it has
multifactorial, Ron. It's just like everything else. It's multifactorial, Ron. Yeah.
Yeah, I mean, life events. I'm sure life events and situations play a huge role too.
But here's the thing, Ron. What is your underlying risk for it? Some people have great lives and they're born with depression. Mm-hmm. And they weren't beat up by their mothers and fathers. They weren't sexually abused. And again, these things are horrible things. Traumatic brain injury. There's war. Policemen and firemen, not to mention first responders and other people, go through traumatic events. It's called PTSD. I take care of these people. Matter of fact, the man that died was a warrior, a hero, one of these, military. And they go for the high. So these guys, they go where they need that stimulation. And then they get involved with drugs and alcohol, and then now steroids, Ron. So the steroids just exacerbate it. So if you're coming off of steroids, please, people, if you're coming off of anabolic steroids and your testosterone tanks, you're not going to feel good. If you have an underlying depression and you're having a bad day or week or month, and your T is low because of the withdrawal syndrome of steroids, you're now sucking wind, but you hate yourself. You hate yourself for what you did. There's the gun.
Yeah, I mean, you talk and you write a lot about anabolic steroid-induced hypogonadism. Did I miss something in there? One of the words?
No, that's it. And I apologize. Apologize for the phone.
It seems like that's in my case, when I've gone off steroids in the past. And I never did the PCT or anything. I was a moron. But I mean, I always got some level of depression in the weeks after. And I don't know. It's hard to say. Was it a chemical thing, or was it tied into just the fact that I was looking in the mirror and seeing some of the muscle gone and the strength was gone, and now more body fat's coming on, just looking like shit, feeling like shit, tired. Yeah, I would think that's when you're at the greatest risk for depression.
That's it. And they kill. And so my main, if you have to look and boil me right down to the bottom line, what I'm known for, what my movement is, it's awareness of men on steroids. I don't give a shit why they're using them. They don't have to be Major League Baseball players. Matter of fact, now 12 million. There's not 12 million men in MLB.
No.
Even though the Boston Red Sox, God bless you.
Yeah.
So and there's no steroids. There's no more steroids in that game anymore. That's another topic.
Okay.
I love Ron's face, but
yeah,
I mean that's what I heard actually, because they test them so incredibly. No anabolic steroids. They're on growth hormones. They're on GH and other peptides and stuff, but probably not real gear anymore because they just get. But who knows? And that's a nice side venue. So depression, Ron. If you have depression, if you just have depression because it's just bad luck, because that's your medical history, and you use steroids. When you're on steroids, these guys go through periods of mania. But it's great. You're in the gym. You don't need sleep. You're on steroids. You're benching big. You're living big, and then you can take the pre-drinks. The
pre-workout.
Ron.
Yeah.
And then these guys do Nubane. Ron, let's just get it all out there, Ron.
Sure.
Come on, Nubane. This goes back to the 1980s and 90s, 70s maybe. Nubane, Coke. And I'm look, I'm going to say a name, but I'm not going to go into, I'm not going to stimulate this. Rich Piana, it's a complicated scenario. I read the autopsy report. It's on my website. It's on my YouTube, Anabolic Doc YouTube, Rich Piana. Yeah. So it's not a slam dunk. I read scientifically why he died. I told people this is what I interpreted the autopsy report as a physician. So, but why did he die? Did Rich have depression? Was Rich, guys like Rich, brilliant guy. That's a guy with mania. It's just no question. I mean, I know Rich, and I knew him, but the mania. I take care of guys that run companies, cops to CEOs, and you know what? They all have some form of a low grade. It's called it's a low grade kind of mania that can be very functional for you.
Right.
But you'll have an episode in life that will crash you. I'm just being so humble, Ron. It's crazy. So I want to bring attention. If you have mental health, men don't talk. You took the words right out of my mouth, Ron. Men don't go to doctors for anything.
And another thing is, like you talk about, you know these patients that are on 1, 2, 3, maybe 4 different kinds of antidepressants, and they all have their side effects. And a lot of these side effects are things men would want no part of, like your sexual function is compromised.
Yes.
You get tired. I mean, the list of side effects is so long. I don't know if these guys would even think it's worth it to be on the antidepressant medication with all the side effects that you have to deal with.
So let's talk about that, Ron. So the medications, and I have a man that joined this week, literally, who's on Lamictal and bupropion, Wellbutrin.
Yeah.
He needs Lamictal. When I see Lamictal and other atypical antipsychotic medications, I know I'm dealing with someone who has severe depression. And indeed, now his sex drive and his sexual function is just gone. So he started on testosterone on his own, and it helped. But now it's just very complicated. So he brings his case to me, and I'm going to be working with a psychiatrist. So because the last thing we do, we can't just stop those medicines, Ron. So he's like, Doc, look, I almost took my life a couple of times. I've been through this for decades. He's 59 or something, in his late 50s.
Yeah. I'm
just jumping around to different patients I have. I don't want to implicate anyone.
Right.
So he knows and he loves his psychiatrist. It's a woman. His psychiatrist is very good. And she said, you have to go see Dr. O'Connor because your testosterone levels are playing a role in why you're up and down. And if you're going to be on testosterone, we need to have an expert stabilizing it, not to mention for everything else, estrogen levels, prostate, heart. It's complicated. So he said to me, we are not going to be playing the games anymore with taking my meds off. Now, he's bashing himself because he would stop his medicines because it affects his erections and his libido, and he gains weight. Everything you said, Ron. Now, the answer is, it's not a perfect world, guys. So he needs more cognitive behavioral therapy. He needs to exercise as much as he can. He needs to have a great environment. He needs to do cognitive behavioral therapy. He needs to have loved ones around. Ron, I pull every stop out. But then he's going to have, the medicines are going to be there from the psychiatrist. We're going to stabilize testosterone, and I hope he doesn't kill himself one day. But you know what? These guys, people are at risk for suicide. It's just the reality.
So, I think something we really need to discuss is the fact that the whole body dysmorphia issue, because people look at someone with this great physique and they think, well, that guy's got no problems. That girl's they look fantastic. The world is their oyster. They've got everything, and there's no reason they should ever be sad or depressed. And a lot of those people are miserable. They're miserable. They look at, I know people that look in the mirror and see nothing but flaws. Beautiful people, beautiful faces, perfect bodies, and they look in the mirror and they're just disgusted with themselves. And it's obviously it's a mental condition. So
here we go. Ron, you're again, good interview. So here we go, because I'll get sidetracked. Body dysmorphia. Let's talk about it. This is a DSM-4. This is in the diagnostic manual, psychiatric manual. It falls under body dysmorphia, and now they have one just for muscle dysmorphia. Ron.
Yeah.
And there's it's called. Let's otherwise known as reverse anorexia,
Bigorexia.
bigorexia,
Yeah.
Dysmorphia with a subtype of muscle dysmorphia, they call it, or something. Now you think of someone incredible superstar like Michael Jackson. So Michael Jackson had body dysmorphia,
Yeah.
right? Because he kept doing the plastic surgery and all that, right? He never felt acceptable. Now, that's an elite star who, in my book, was such a talented, incredible person that just suffered from being such a celebrity. Now, this is a similar, Ron, you and I both know bodybuilders, and you know the pros a lot more than me. I take care of average guys now. The pros don't come because I'm a career wrecker.
Right.
So, and I'm not joking. So, but Ron, let's talk about it. These guys come, and then every week I do consults with, I'm not coming off, Doc. I can't come off. Why? They're conflict, Ron. This is 150,000% body dysmorphia. You have a little of it. I have a little of it. So this is all part of this whole conundrum of underlying mood disorders, having personality issues. I'm not saying personality disorders. Some people, Ron, have personality disorders.
Yeah.
We're not going to say who and what. It's just no. Then you put that thing into where they call it achieving the perfect self. And then that's physically, a woman or a man. And then you achieve it. And that's when you start to be your own worst enemy. Now, I'm not a psychologist, but I work with psychologists. And Ron, it's incredible. That's what it's this is what my book is about. America on Steroids. Chapter 13 talks about the data for anabolic steroid-induced hypo. It's right there, Ron.
Yeah,
you got the book.
There it is.
There's other chapters where I've worked. My co-author is a PhD in social welfare. It's a woman. She's a psychologist. She's interested in body dysmorphia. Why do men take these medicines and destroy their lives until death in some circumstances?
Yeah.
So, Ron, why we have to talk about the underlying, and then who died last night? That horrible. There was
Mandy Blank passed away.
I'm not going to go into it. We don't know why.
Right.
Drugs, alcohol. Did she have a heart attack? Did she just die in her bathtub for no reason?
Yeah.
So, but Ron, probably had something to do with being such a high level person in this beautiful, Ron, where people look and they go, yeah, you are gorgeous. I would do anything to look like you and to be, well, you really think you would do anything? Come to the dark side.
Yeah.
I don't know. But Ron, so we need to bring attention. How many people, Ron, let me ask you a question.
Sure.
Do you think any professional bodybuilder that has IFBB Pro, means they've done steroids to some degree, they've made the sacrifices that I agree they're incredible, because I'm a powerlifter. I've done these. I've lived the sacrificial life. I understand it. It's an incredible piece. There are side effects, and you will pay for it in your mind, pay for it in your life. And do you think how many people on the pro level, no names mentioned, have body dysmorphia and is it diseased?
I could say 100%. To some degree, to some extent or another. I don't think anyone is totally free of that condition. I think there's a rare small percentage that bodybuilder, even at this level, at this elite level we're talking about, that do it just because they're really good at it and they're completely 100% objective and it's just a business to them.
Oh, God.
And it's not a personal thing and they're not trying to compensate for anything that's lacking in their life or pain that they've gone through in their past. But I think most had something in their past, something in them drives them to keep going and keep trying to develop the body more and more, and they're never ever satisfied with what they see in the mirror. To a man and a woman, everyone I talk to, if I ask them to critique themselves, they instantly have a long list of things that they rattle off. It's like, well, my back, I need more back thickness, and my waist is too wide, my calves aren't that great, and I'll ask them to say, what do you think your strong points are, what your weak points are, And the strong points they'll spend a couple seconds on, and the weak points they could talk all day about their weak points. You know, it's terrible that you look at, like I said, you look at these people and you think they're so pleased with themselves. The general public says, oh, they're all stuck up, they're so full of themselves, they got no problems, they're so lucky, and they don't know that inside these people a lot of them are really insecure, they're not happy with themselves, and even if they think they have a great body, they'll say, well, that's great, but you know, what else have I done in life? You know, everyone goes through, I think almost everybody goes through some level of depression at one point in their life or another, if not on a regular basis.
Absolutely. But do you kill yourself over it, or do you perpetually destroy your life with drugs and alcohol, including steroids, for it?
Yeah, I could argue that recreational drugs are a form of slow suicide. I don't think I'd put steroids in that category because, you know, I don't want to kill myself. I don't want to die. Obviously, I think I'm shortening my lifespan somewhat. I don't think that's, you can argue that point. I could try, but I'm not going to get very far. I'm not going to live as long as I probably could have lived.
Well, that's not true, Ron. You have the Anabolic Doc by your side.
Well, you're going to live to what, 120 or what was your goal? 118?
110.
Oh, 110. Oh, I think you're cutting back. But yeah, I'm not making it to 110. But yeah,
But you don't do the massive. I don't think you do steroids. You don't do that anymore.
What's that?
You don't do steroids anymore. You just do a little TRT now.
I do more from time to time, a couple phases throughout the year. Absolutely. Yeah, I'm not going to. People demand to know exactly how much and this and that, and that's none of their damn business. But yeah, but I'm not. I don't claim to only be on TRT. There are points. There are phases of the year where that's all I'm on, but there are phases where I'm on more than that. So if my health was my number and longevity was my number one priority, I wouldn't do that.
Wow.
But I have body dysmorphia, and I'm not happy with. I'm not happy with the way I would look if I was doing 200 milligrams of cypionate a week.
Wow.
All the time. I would lose a certain amount, and I'm not a massive guy, but I would lose a certain amount of size, and I wouldn't be happy with that. So I'm willing to, you know, compromise and risk my health a little bit to look the way I want to look.
This is incredible.
On the other hand, I'm not willing to go that extra step and take what it would. You know, I don't even know how much bigger I would be or would have been. I'm 49, so this is kind of all like a mood argument. It's kind of late in the game to even worry about it now. But had I really gone full force and done every steroid in the largest amounts possible, insulin, IGF-1, growth hormone, anything I could get my hands on, and done it massive quantities to the level like, you know, a Piana or a Boston, like mega cycles, I would probably be bigger than this. I don't know how much bigger, but I would have gotten bigger. But, you know, in my heart of hearts, luckily I married young and I had kids fairly young, so I always had that in the back of my head, said you can't do that because I'm not just living for me. I got to be around to provide for these people, and I lost my dad young, and I don't want my kids to deal with that. It's a terrible thing to lose a parent and not have them around. So, yeah, I mean, but yeah, body dysmorphia, absolutely, I have that. No question.
But see that, Ron? But now you articulate that like, Ron, this video should blow up with the grace of God to millions of views because people should see it. You're a normal guy. You're a regular guy. You're very articulate. Your health. We look at what you just said. Yeah. So that's why what I want to do for guys is I want to work around that. And then as you're doing that, why would you die? Well, heart, kidney, hopefully not suicide. You don't have depression, so you're okay.
Yeah.
And all the things apart from, so I always say, guys, I work from the chin down. So that means psychiatric stuff, I don't work in the brain, except today we're going into that. But if I could provide you and my patients that are using steroids help, my medical know-how to prevent you from damaging your heart, which we have, that's a great thing.
Yeah.
And now, so that's the chin down stuff. That's my, cardiology. We're taking a break this week. Yeah. And then for the chin up is why we have to talk about this because mental health is also rampant. And it's a paradox of what you see, the health paradox in the bodybuilding fitness world. And these people, Ron, you and I are around them all the time. We're one of them. It's the opposite. You've been to the after hour parties, Ron. You know what's going on.
Oh, yeah.
And these are people that are amazingly motivated, but the motivation is coming from a negative. You're right though, but boy, you want to squat 405 for 20. You just keep thinking how much you're a piece of shit and you need to do this, and you're suffer. Now, some people don't. Some guys think of all goodness. They say, I've been through all this myself, and the guys have always said to me, Doc, don't get crazy, don't use anger. That's when you're going to tear something. Come from now. This is right, Ron. So that's almost a beautiful thing, and it is beautiful. But then, why are we doing this? Why are my legs bleeding? Why have I torn 5 muscles off my body?
Yeah, I think to be a bodybuilder at that level or a powerlifter or whatever, but let's use bodybuilding because that's what I know the best. You can't be a great bodybuilder if you're ever satisfied with yourself and you're ever happy with what you see in the mirror, because if you were, what's gonna get you up the next day and try to beat the last workout and what's gonna drive you to go through all that pain and take your sets beyond failure and drop sets and like you said, if anyone out there who's ever squatted 405 for 20, I've never quite got 20, but it takes something mentally to dig down to deep that. And where's that mental ammunition come from? Usually, like you said, it's got to be from a place of you suck. You suck if you don't do this. You're shit. If you do this, you're good. But if you don't do this,
and and this is why there's such a paradox, Ron, of such greatness and amazing energy and amazing abilities and power from universe power when you're squatting and your partner or your training atmosphere go and just like that's the most incredible. That's how you become NFL. That's how you become a Fortune 500. I take care of these people now.
Yeah.
So, but there's that edge, Ron. There's that edge. Anything in the life, there's an equal and opposite negative. So you're going to suffer and pay for that. And this is just what I want to talk about. So we all pay for it. So should we, in the end of this video, Ron, we should say, go to healthcare providers, try to be balanced. You know what? Also, guys are going to go, fuck you, game on. It is, so this is what life is, Ron.
Well, let me ask you, doctor. You refer a lot of your patients to psychiatrists, right?
If they need, I refer my patients to any other caregiver in the world that I feel I become the medical manager.
Do you know what percentage, how often they actually follow up and get that?
Yeah, I'll tell you. It's in my practice. Yeah. We're working with depression, including standard depression and manic bipolar depression. Of my guys I take care of, 1% to less than 2%, 3%.
Those are the ones. Less than 2%. They don't. Okay.
Because think about it, Ron. It's a selection bias. I cost money. Fuck all the haters that I don't cost that much money. Yeah. So guys who have to come to me actually have to have their shit together. So it weeds out severe and hospitalized type guys. Okay. So you can imagine, and I do get parents paying for loved ones that come in. It's not all just a mother or father for a child. It could be a brother, and it could even be a young guy paying for his dad to come. So, I see that, and then that's going to be worse because those patients are not, unfortunately, they're not viable, people in the community. I'm not saying they're bad people. They're just not functional people. To be a functional person, Ron, takes a lot in our society this day and age. Yeah. So you don't last if you have real full-blown depression. So that's the reason why in my practice I see tons of heart disease and kidney disease because they're young and they're fucked and they're like, holy doc, help me. Yeah. But they don't have depression yet. Right. Or if they do, it's not severe. It's moderate. It's called mild or moderate. Now, when your kidneys fail and you won't be even lifting weights, and I'm doing with a guy right now, we're putting a fistula in him. Yeah. You know what a fistula is, people? Ron, you know what a fistula is?
I think it's like a hole between two other holes or something.
Yes. So you can ask anyone you know. You have some friends, people you may work with that we're alive, honey. So you can ask men that you know that have had renal failure, kidney failure, they're transplanted, and I assume they went through a period either with peritoneal dialysis or hemodialysis. And when you go for hemodialysis long enough, they put this huge varicose vein bubble on your arm, and it looks horrible, it feels horrible, and that's what they poke 3 times a week to go in to hook you up to the machine.
Ugh.
So
Gross. So let's take this full circle, doctor, because we've talked about this before, but now it really applies. Is you've dealt with patients who went to their general practitioner and they were on steroids, and the doc said, they said, I want to get off steroids. Can you help me wean off? And the doctors were, they didn't want anything to do with that. They don't know anything about it, so they don't want to deal with it. So they just say, cold turkey, just go off, and your body will come back to normal, which, as we know, in most cases it doesn't. But that seems to me like a perfect storm for somebody to go through horrible depression, because you're not going to wean them. You're not going to take them down in dose. You're taking a guy from 2 grams of steroids a week. He's 250 pounds if jacked, and he goes back down to nothing. A couple months ago.
That's why I have a medical license fully intact. Because what I'm doing is ethical.
Yeah.
That's unethical, but I won't give those doctors a hard time, but sooner or later I will, because get educated. Realize that this is a mental health crisis that's happening. When you come off steroids, with or without depression, you're at risk of, you're going to suffer 100%.
Yeah.
How bad's the suffering going to be is the question. And if you have underlying depression, you're done. You're dusted. That's why Ron, no one even comes off anymore. Let's not play any games here.
Oh, I know. But I know you hate when I knock the other doctors, but I'm going to do it. So
it's okay. You can.
I can. I'm not a doctor. I don't care. So in a scenario like we just described, I feel like the attitude of the doctors, I feel like some of them know the consequences of someone going cold turkey like that, wow. But they're not really concerned. I think they have the attitude of, that's what you get. You deserve that.
You know what, Ron? Shame on them, and they're going to end up losing their licenses, and we're going to end up putting them in jail, because that's going to be a felony.
Yeah, I mean, what if these people go commit suicide?
It's medical malpractice, sir, doctor. It's medical malpractice. If a person comes in that's depressed, and you say, we're going to stop those medicines, we're going to see if you need these medicines.
Yeah.
Now, people will hear this, and the whole world's watching me now, Ron. People will hear this, and they're going to say, that's crazy. Who the hell's going to do that? Well, why would you do it to someone that you know is going to guaranteed go into suffering? There's one rule here, Ron, as a doctor. Don't suffer. No suffering.
Yeah. And again, I'm going to knock doctors, because this pisses me off. Because someone comes in and says, I'm a heroin addict. I had a late sister who was, so I can talk about it. I know the circumstances. They put her on methadone. They didn't take her and say, bad heroin addict, just go hide in your house for a few weeks and get clean and everything will be hunky-dory.
Good luck.
They didn't do that. They put her on methadone, and they actually picked her up every morning in a van and brought her to methadone clinic, gave her methadone, drove her back home.
Wow.
Talk about accommodating, right? So in these situations with recreational drug addicts, there's a lot more compassion, and the doctors, they're not as willing to, I don't know, if they're judgmental, they don't let it affect their actual practice. Well, I feel like with steroid users, these doctors let their judgment affect the way they treat these people.
They're envious, Ron. Let's just get right down to it. This is a show of truth and evidence-based medicine. The truth is, we have no data on it, limited. But the Harvard guys are certainly doing some work, and other doctors are, including me, obviously. Yeah. But as far as the studies, doctors appear not to be interested in getting educated on anabolic steroid users. It's changing. We may be where we were with doctors treating heroin users 20 years ago, Ron.
Okay.
20 years, and it's very progressive. You have to be progressive, at least in your compassion for people. So these are, and doctors, when they read the data, we have data now. Millions of men, when you come off, you go into withdrawal syndrome, because your hypothalamus pituitary gonad I'm so sick and tired of talking about it, Ron. I'm actually sick and tired of talking about it because it's so irritating to me. You're right. By the way, I agree with you. These doctors are arrogant, bombastic doctors, both men and women, that seem to be so envious and hateful against this person in front of them that probably is a man, not always, could be a woman.
Yeah.
And certainly at that moment looks better than they do. And they're passing judgment, and it's unethical. And when it comes to a heroin user or some poor AIDS patient in Boston City Hospital, which I've been in Boston and New York, where I worked in New York, and Hartford, Connecticut, where I worked during my residency for almost 10 years, including outside when I was working for 10 years when I was a regular doctor. So when you do this, those are pathetic looking. When an AIDS patient's on heroin, they don't look good. So you feel sorry for them.
Right.
But when a guy, I got it, Ron, I got it. When a guy comes in, jacked, good looking, not to mention young, appearing to, this guy's going to suffer, get the fuck out of here, buddy.
Yeah.
Now that, Ron, what doctor, what true compassionate healer is going to put yourself aside, sir, ma'am, doctor? This patient's going to suffer. Now oh yeah? Where's the data? Well, we have the data now. Your brain is going to shut off. Your balls are shut off. If you have depression, I've been through a dozen suicides.
Yeah. And do no harm? Is that the first part of the Hippocratic Oath?
Very good, Ron. First, do no harm.
Yeah. So by not treating someone who needs treatment and is coming to you asking for said treatment, you're doing them harm.
Ron, I think my movement's going quite well. Every day I hear now multiple times a day on some days that patients who may have started with me for a year have moved on to other caregivers and they're getting the compassionate care.
Good.
And all around the country and the world, more doctors are treating and opening their eyes to men that are using steroids. Again, the women using steroids is just another. I think those women are just even pushed deeper underground than men are.
Oh yeah.
And that's just something that I don't even want to get into. I just don't treat women. I've looked at some women on their labs. I observe women, but I can't treat a woman with androgens. A man coming off steroids is going to need androgen therapy, right?
Yeah.
So that's what in addition to whatever else, psychiatric therapy, kidney, hypertension, cholesterol, sugar, diabetes, enlarged heart. This is my day job. So that's what guys. I'm not anti-aging. Guys pay me I'm like the primary care doctor on steroids. I mean, I understand it. So, and it's a lot of work. People have all different medical conditions. When they're young, it's amazing though, and they're on steroids, they just have a huge reserve.
Yeah.
And again, Ron, last week, I can't even tell you, there's a waiting list now in a few weeks, which I love, and I guess it will build up more and more. I don't give a rat's ass. My number one priority is not money. My number one priority is doing what I do right now. So I'm hell-bent for this. And we're here, we're in Florida. We just hired another person. We got so many people coming in, Ron, and different degrees of disease. Some guys are coming in completely no disease. They just been on steroids and they're 26 and like, Doc, help me out, man. Walk me through this. A guy said to me today, walk me through this. And that's for you, sir. That's for you. The guy that I saw today, because I told him, there's no names being mentioned.
Yeah.
He said, Doc, because I say, what are you doing here? What's going on? This is all I do every day. Doc, I want you to walk me through with this. Walk me through. And so I'm walking him through history, physical exam, labs, his steroid use. I did the history today. And I'm not going to talk about it any more than that. Walk me through. So doctors and you patients and you people out there, tell your caregivers, walk me through. Get my book. Don't get my book because people think I'm trying to make money. But check it online. Yeah. Read it online about anabolic steroid-induced hypogonadism. You're right, Ron. ASH. And read the guys from Harvard. Read the guys from Baylor. Read the guys from psychiatric guys in Cleveland Clinic years ago. They said you can't just let a patient on steroids leave the office.
Wow. Yeah, it's going to take a while, but I think largely through your efforts and, efforts of colleagues of yours, things are changing. And thank God. Thank God. We go through this every week.
Ron, you know what though, Ron? It is, in the end, so to conclude, I don't know, mental health, people have health issues, from diabetes, hypertension, cholesterol to depression. You want to work the best. Everyone's Googling stuff. Don't Google so much. You're going to do it anyway. I mean, if you go, the caregivers are there, Ron. If all you have to do, they don't even have to be a doctor. It could be a nurse practitioner. It's got to be some health provider it's an APRN, a physician's assistant, an advanced level nurse. I'm just being honest. The primary care is gone. I don't exist. They're not. I teach in the med school. Gone.
Wow.
Over. So we have to accept nurses as doctors now, and don't get me involved in that. We have no choice.
Yeah.
So but here's the deal: they can be very good. They can be very good, and most of them don't claim to be doctors, but they're acting as your manager and your healthcare provider. So suck it up. So if you go to that person and you say, hey, you know what? Here's O'Connor, anabolic doc. No, he's not giving a fucking blessing on steroids. He's an anabolic doc. He's the guy, he's the expert on steroids, and I got an attitude, obviously. You know what? You read the stuff if you're interested in helping me, because I can't do this alone now, Ron. So go out and go. Dr. T, let's go. Start seeing patients. Get a goddamn, hopefully will they let Greek guys come into the country? Hopefully they will. I mean,
I think he likes Athens too much. I don't think he's going anywhere.
I'm going to Athens, actually. I'm out of here. Forget Florida. I mean, I'm gonna segue Connecticut, Florida. I'm gonna spring over to Greece. I may never come back. You may see me and Dr. T. So you know what though? But Ron, you got to reach out, people. You got to go. It's a pain in the ass. You got to go to these clinics. Read, bring it to their attention. And they can evaluate you. And there's medicines, there's cognitive behavioral therapy. You could train hard, and you could get it all together. Diet, right, Ron?
Yeah.
It's so sad. I lost another patient that succumbed to his depression, and I could not help him.
Yeah. So I guess that would be the final message is, if you need help, please go get help if you're watching this. Because, you only got this one life, whatever you may think.
And again, if you're on steroids, it's hey man, game on. But just know that it could be exacerbating, and it could be a turmoil. And I've seen it all. And you need someone to walk you through and to help. And don't do it on your own. And if you have insurance or no insurance, I think it's worth it to go to a good. There's so many good doctors out there, Ron, and there's limited time though. But men don't go to doctors.
I know. That's why my dad passed away. He didn't go to a doctor. Yeah.
So I'm trying to change that. That's why my whole movement is just men's health only.
Cool.
That's it.
Again, you're doing great work, doctor. Please keep it up. I know you will. Train the next generation of doctors. Please do as much of this as you can, because we need more and more awareness. We need more and more people to be on the same page with this, because it's about time. It's long overdue.
It is, Ron.
All right. Well, thanks for the idea. This was your idea today. I'm glad it was an important subject that I don't think we ever would have gotten around to otherwise. So thank you. So let's wrap it up with one last plug. Get the book, America on Steroids: A Time to Heal. You can read all about anabolic steroid-induced hypogonadism, understand the ins and outs of that, as well as many other subjects in there. That's on Amazon.com. And, of course, the doctor's videos dropping every week on his YouTube channel. Look up The Anabolic Doc. You'll find those. Those are much more involved than the discussions we have, because, that's a whole other subject. So check those out. Thanks for watching, everybody. We'll catch you next week with Ask the Anabolic Doc.